The one-hand scoop technique. To avoid an accidental needle stick injury, never recap a needle using both hands. If the needle has to be recapped, use the one-hand scoop technique. 1. Leave the needle cap on the surface and guide the sharp-used needle tip into the cap using only one hand. 2. Recap the bulk of the length of the needle by moving the syringe forward. This allows the needle to enter the cap in a scooping movement. 3. Lift the needle and syringe vertically, and once
As a dental assistant, it is necessary to protect yourself from infectious diseases by having the proper protection. This dental assistant, you will notice, has on protective clothing. She has a lab coat with a high neckline and long sleeves. For routine dental procedures, a cotton polyester blend fabric is satisfactory. Any buttons and zippers are kept to a minimum because they can hide bacteria. When ready to begin dental assisting, the dental assistant places on her mask, then her safety glasses, and then each glove. When she places her gloves on, notice that the gloves come over the cuff of the lab coat to cover any skin. After the procedure is completed, the dental assistant removes her gloves, pulling one inside the other and discarding, then removes the safety glasses, and then the mask. Doing it in this particular order reduces the chance for disease transmission. Personal protective equipment is very important in providing protection for the dental assistant. Masks are needed in dentistry to cover both the nose and the mouth of the dental assistant. The two most common types are the dome-shaped and the flat type, like the ear loop mask. It is the preference of the dental assistant to pick the mask that is the most comfortable to wear and also protective. It is important for the dental assistant also to select the mask that fits their face the best. The mask is put on before gloving and protects the dental assistant from inhaling infectious organisms spread by the aerosol spray of either the dental handpiece or the air water syringe. It also protects against sudden and unexpected splashes. It is worn whenever splash or spatter is likely. Masks are changed between patients or even if it becomes wet during a procedure. The dome-shaped molds very effectively to the face and creates an airspace between the dental assistant's face and the mask. The flat mask can also be shaped over the nose and the loops are placed around the ears. Masks are necessary in being a protective barrier for the dental assistant during dental treatment. Protective eyewear is always necessary as a dental assistant. There are two types of protective eyewear: glasses with the protective side shields and clear face shields. If there is laser treatment performed, the dental assistant will wear special filtered lenses in the glasses for eye protection. Proper safety glasses have front and side protection. If you happen to wear prescription eyeglasses, you must add the side and the bottom shields or wear safety glasses that fit over your prescription glasses. Even if you have contact lenses, you must still wear eye protection. A chin-length face shield can be worn in addition to a mask and glasses. Eye protection will not only shield the dental assistant from spatter and caustic chemicals, but also from pathogens and flying debris. If protective eyewear is not worn, there could be irreversible damage to the eyes. Eyewear is cleaned with soap and water, or if visibly soiled, cleaned and then disinfected between patients. As a dental assistant, your eyes are very important, so protect them. The particular type of glove worn in the dental practice will depend on the unique procedure the dentist is performing. The examination gloves are the most frequently worn glove by the dental assistant assisting the dentist. The most common ones are the nitrile, latex, or vinyl. These are often referred to as exam gloves or examination gloves. They are relatively inexpensive. They are clean but non-sterile. A variety of sizes are available. The sizes usually vary from extra small to extra large. They are made to fit either hand. A glove that is too large or too small could be uncomfortable or cumbersome to wear. The dental assistant will select the size that best fits their hands and fingers. Gloves provide a protective barrier for the dental assistant. All rings and jewelry are removed before wearing gloves. Nails are trimmed. Therefore, the dental assistant is not apt to tear through this protective barrier. If gloves do become damaged during treatment, they are changed immediately and proper hand washing and regloving procedures are followed. Before gloving, washing hands with antibacterial soap or using an alcohol-based hand rub is necessary. The alcohol-based hand rub is most effective over soap and antimicrobial hand washing. Concentrations of 60 to 95% are most effective. If the dental assistant's hands are visibly soiled, then hands must be washed first with soap and water, followed by the alcohol-based product. When putting on examination gloves, pull the glove over the lab coat cuff, covering the skin on the hand and wrist. When removing the gloves, tuck one inside the other and then discard. Then thoroughly wash hands or sanitize. Gloves are an excellent way of providing a protective barrier for the dental assistant.